For surgical treatment of an otehematoma, it's important to perform two incisions, one at the inner and one at the outer surface of the pinna, to allow complete fluid drainage. An S-shaped incision is made on the outer surface of the pinna, full thickness through cutis and subcutis. The underneath cartilage should not be incised. Afterwards, the hematoma is debrided, for example, using a surgical curette to allow healing of the tissue. The same technique is used on the inner surface of the pinna. In this case, almost no fluid is present on the inner side. Both incisions are not closed primarily. Special compresses are used to cover the inner and outer surface and create pressure onto the pinna and hematoma cavity. Besides, fluids are absorbed by the compresses. During the next 14 to 16 days, the tissue can heal between both compresses. Monofilament, non-resorbable suture material armed with a straight needle should be used for compress fixation. Straight needles can be guided by hand. We start at the outer surface, penetrating the first compress, the pinna, and then the second compress. With a distance of approximately 1 centimeter from the initial stitch, the needle is pierced the other way around to create a simple interrupted suture pattern with suture ends on the outer surface. A surgical knot is done to secure the suture, using some amount of pressure to compress the pinna between the two compresses. It's important to place the sutures along the long axis of the pinna and not perpendicular, because the vessels supplying the pinna run along the long axis. Placing sutures perpendicular to the vessels might lead to ligation and ear necrosis. Depending from the size of the ear, multiple sutures are made to distribute pressure homogeneously along the whole pinna. Normally, 5 to 10 sutures are made. The compressors should cover the whole pinna. In case of overlapping, the compressors can be cut into shape following the natural curvature of the pinna. That's our final result. The ear is compressed between both compressors like a sandwich, and after 2 to 3 weeks, sutures and compressors can be removed.